Hello, my name is Dr. Sam Lipworth, and I'm a medical doctor and researcher at the University of Oxford. In the UK, we are incredibly lucky to have the NHS, and not just because it gives everybody free access to healthcare whenever and wherever they need it, but also because it enables research to be done on healthcare data in a joined up way, which allows us to learn about new approaches to healthcare that otherwise wouldn't be possible. Now, infections are an incredibly common reason for patients needing to come to hospital. And I'm particularly interested in some bacteria, particularly E. coli and Klebsiella, which are common causes of urinary tract infections in particular. But in some patients, particularly in older patients and those with underlying medical conditions, these bacteria can cause serious disease, including bloodstream infection and what you might have heard referred to as sepsis. Even where the actual infection itself is not so severe, the complications that can arise from this can nevertheless land patients in hospital for many weeks or months and lead to a real deterioration in their quality of life. And I'm thinking of things like falls or confusion, particularly in elderly patients. In the UK, infections, particularly those caused by E. coli, have been becoming more and more common over the past decade, and little progress really has been made to stem the rise of this. So, one of the questions that patients and their families commonly ask me when I'm working in the hospital is, why did I get this infection? Or, what could I have done to stop it? Or how can I stop these infections happening again to my loved one or myself in the future? And obviously, these are excellent and very logical questions, but for various reasons, they've actually proved very difficult for scientists to answer to date. And that's really sort of stemmed our progress of trying to reduce the rise in these infections. My research aims to answer some of these infections by combining genetic sequencing data from bacteria with anonymized healthcare data provided in the Infections in Oxfordshire research database. The emergence of cheap and high throughput sequencing technologies over the past 10 or 15 years has been really exciting. So, we can now sequence a patient's E. coli isolate that's been grown from their urine or from their blood, and we can sequence the genetic code of that in a matter of hours for about 30 to 40 pounds, which is just unbelievable. But on its own, that sequencing data is just a string of letters. It means nothing more than that. We can predict the proteins that those sequences are encoding, but without the underlying patient data, such as the demographics of the patient, the medical condition that they came to hospital with, and what happened to them, the outcome as a result of their infection, then this is quite sort of two-dimensional data. It on its own isn't that powerful, but when you combine it with patient data from the Infections in Oxfordshire research database, you can really answer some very exciting questions that really have the potential to answer patients' questions and lead to real advancements in the way that we deliver care for these patients. So, to give you some examples of some of the recent work we've done using the combination of genetic sequencing data and the Infections in Oxfordshire research database, we've conducted a study to look at strain types of E. coli causing bloodstream infections in Oxfordshire over the past 10 years. And we've shown that these actually haven't substantially changed, which sounds a bit boring perhaps, but actually it's quite important because it means there hasn't been a new strain that's emerged that's kind of extra good at causing severe disease in patients. We've identified a gene that's found significantly more in patients whose bloodstream infections begin in the urinary tract, and we've shown that the presence of this gene is associated with a better outcome. And we've also been able to think about what an optimal vaccine against E. coli might look like and estimate the potential coverage of some vaccines which are currently being developed that are being trialed in clinical trials in humans at the moment. Finally, we're working on ways to try to improve the prediction of antibiotic resistance based on the analysis of bacterial DNA. And we hope that in time, this will reduce the time it takes for doctors to be able to select the correct antibiotic with which to treat patients who come to hospital with these infections. So I hope this has been able to give you a sense that IORD, or the Infections in Oxfordshire Research Database, is really a phenomenal resource which hugely enhances our ability to conduct research into severe infections and associated antibiotic resistance. And it really is a crucial tool that enables us to begin to answer questions which really matter to patients and their families.